Welcome, this is a recorded session of the Post-Quantum Cryptography Conference of the PKI Consortium. This conference would not have been possible without our sponsors, PQ Shield, SSL.com, Entrust, Keyfactor, HID Global, and the organizational support of the Post-Quantum Cryptography Working Group of the PKI Consortium, and in particular, Entrust, Keyfactor, and Logius. Would you like to join the PKI Consortium? Go to pkic.org/join, or contact us if you would like to become a sponsor.
All right, so next up, we have a panel discussion, which I have the pleasure of moderating. So I'll welcome the speakers to come on up. Strategies for transitioning to future-proof cryptography. As they come up, I'll introduce who's going to be joining me. So first off, Lori Thorpe, Quantum Safe Industry Lead at IBM, leading their Quantum Safe Telecommunications initiatives. As chair of the GSMA, Post-Quantum Telco Network Task Force, she's also at the forefront of preparing our communication infrastructure for the quantum age. We've got Jaime Gomez Garcia, head of quantum at Banco Santander, where he focuses on both the opportunities and threats that quantum computing presents to financial institutions. He's also the chair of Europol Quantum Safe Financial Forum, which includes more than 40 organizations collaborating towards the transition to quantum safe cryptography in the financial sector. And Scott Stowe, president and CEO at DirectTrust, Stewie, where he has expanded the organization's scope through strategic acquisitions and mergers, strengthening the healthcare data exchange security, including developing the community's post-quantum response strategy. So welcome. So I've just introduced you all, but perhaps we could just go around the table. You guys can just talk a little bit about your work at your organizations as well as work around PQ.
So, hi everyone. My name is Lori Thorpe. I'm part of the IBM research team, and my background is in telecommunications, but the focus of the team obviously goes across different sectors. We've been working with a number of organizations and a number of governments around preparing for the post-quantum cryptography transition, preparing for crypto agility. This is the work that I've been doing here at IBM over the last sort of 3 or so years. As I mentioned, my background is in telecommunications, so one of the roles that I've taken on is around chair of the GSMA Post-Quantum Telco Network, and that really is bringing together the industry ecosystem to help prepare for the post-quantum transition of the telco sector, which, as you can imagine, because it's a heavily regulated industry, because so many of us rely on telco services, and because it's so critical effectively to digital society, digital economy, it requires a level of preparation and coordination that is something that we really need to prepare for in the right timescales.
I'm Jaime Gomez Garcia. I'm head of quantum technologies at Santander Bank, where I work with business areas in understanding how we could benefit from quantum computers in the future. And I'm working with cybersecurity in trying to protect ourselves from the threat of quantum computers to cryptography. I co-lead the Santander Quantum Threat Group with my colleague Dan Cuthbert and with collaboration from many, many people. I'm remembering now Mark Carney, Juan Capristan, Daniel Gomez, Shamek Semyon, a lot of people. And we are firm believers that collaboration is fundamental to address this challenge. So this is why we started in spring 2023 the Europol Quantum Safe Financial Forum as a way to collaborate within the financial sector to address the challenge together. And well, I'm speaking tomorrow, and I'll provide maybe more details on these topics.
Hi, my name is Scott Stowe. I'm president and CEO of DirectTrust. And DirectTrust is an organization that we basically oversee a large private PKI in the healthcare information exchange ecosystem. We've been around since about 2010. So we oversee a community of service providers, kind of unique in the healthcare ecosystem, where these service providers are actually the operators of the PKI environment. What I think is special about the healthcare ecosystem is, while we are regulated in much the same vigorous and strenuous way that telco and the banks are, we're also we also suffer from an awful lot of non-compliant regulated entities. So there's a ton of work that needs to be done in this space. So the good news for us is that our community is well equipped and well appreciates the desire to move from one state to another, to automate, updates. Those kinds of things are, I think, effective in the service provider community. The challenge for us is, as a trust framework, we're also needing to help their clients, our clients' clients, understand their obligations and their inventories and their explicit requirements around improving their cybersecurity health generally. The cornerstone of regulation in healthcare is HIPAA, which I think most people have an understanding of. But the HIPAA security rule there's a new proposed rulemaking that has just come out that is mostly focused on cybersecurity elements, but also has a post-quantum element to it. So we are very, very much focused on this in our organization and trying to make sure that our community is prepared as soon as there are certificates. There is a roadmap to create such certificates. We're going to be eagerly looking to create that inventory, create the testing mechanisms, create the roadmap templates for our community.
All right, thank you. So as you can see, we've got subject matter experts from financial, from healthcare, from telco. We will be trying to leave room for questions towards the end, so stay tuned for that. But let's jump into the content. So as the title suggests, we'd like to have a look at some of the strategies for preparing for PQ, PQC. So putting it out again to each of you, which I'll probably do for all the questions from your different perspectives. What does your strategy look like when it comes to future-proofing your organizations? Where did you start, and what are a few of the things that you've already done?
Should I start? Yeah. Okay. Yeah, so we started looking into quantum technologies in 2019. In 2020, we created the Quantum Threat Group as a collaborative effort between the Cybersecurity Research Center and the Crypto and Blockchain Center of Excellence. In 2022, we started doing a quantum risk assessment evaluation. We started also reviewing our internal policies with regards to cryptography and updating them, testing the impact of the new standards that are coming, and thinking about what the future impacts would be. I made a talk explaining this path in the last PQC conference. And one example that someone reminded me today is that while many people talk about harvest now, decrypt later, we identified, for instance, that the impact to digital signatures is operationally more important in the financial sector. It might not be so in other sectors, but you need to do your own assessment. So, well, basically that's the path we have. We have created our strategy program, so that takes a lot of effort to raise awareness, develop internal talent, and bring together the communities. We are still in an ongoing effort to understand the internal use cases, because they are huge. So I don't know all the nails that Tim was saying about where we are using cryptography, but we are gaining a lot of knowledge about that. So as I also said in the last PQC conference, you do not need standards out to start doing your job. You do not need the software with post-quantum cryptography built in to start doing your job. there is so many things you have to do before you actually implement anything that you should better start now.
So fully agree. I think that also applies for the telecommunications sector. One thing maybe to add is around funding and prioritization, which we've not really discussed. I mean, I really liked one of the charts that I think Bill showed earlier. One of the there's a chart with governance, and one of the things that I think is missing from there is the funding and the investment. And this is obviously very, very critical, because we need to be looking at this as almost as a gift, because if we think of PQC, you know, what could have happened is that actually cryptography was broken, and we didn't have the luxury of, you know, 10 or 15 years notice in being able to prepare for this transition. But what that also means is that it's very easy for someone to look at it and say, well, do I really need to do this now, or can I kick the can down the road and do it a little bit later? And I think that this is one of the areas where actually we need to take a balanced view. There are a lot of other things going on. There are a lot of other impacts to security. But this is definitely one of them, and it's one of them that, you know, we know is going to create an impact, and we've had huge amount of notice on the impact that it could create. So we need to be able to leverage that. We need to be able to make the most of that. And I think for the telcos, ultimately the industry is going through some sort of challenging times, as many other sectors are, and they're you know, it's not easy to allocate funding. There isn't spare funding that's just knocking around that we can allocate. So we do need to look at how we make a conscious decision of how we make the most of the time that we've got, in a way that we increase the efficiency, we increase the security, and we ultimately make a decision around, you know, how secure do we want our networks to be? What is it that we're prepared to compromise on? And if we don't want to compromise, then, you know, the time for action really is now.
Thank you. Yeah, I want to come back to that prioritization topic after, for sure. But yeah, Scott?
Yeah, so one of the things that we have working for us is we have an accreditation program for our community. So the service providers that operate in our community are accredited by us. And so the first thing that we are looking to do is to make changes to our accreditation criteria to support these new obligations, really in alignment with the expected regulations as they actually emerge. So those expected regulations then, though we'll have expected independent assessment of those, of the status of a regulated entity's compliance. So I think that's one of the things we're doing first. We've actually also got a big education focus. The big challenge with, again, there's two tiers. There's the service providers, and then there are their clients. The clients are the ones that we're most worried about, and that we frankly need to take some responsibility as an organization in healthcare who understands PKI to communicate the importance of this to that community, because they're not really focused on this topic. They have much bigger fish to fry, things like, how do I find nurses to hire and doctors to hire? How do I survive a negative margin for 4 or 5 years in a row? So if you're a healthcare organization, it's pretty difficult for you to find funds for cybersecurity, but really difficult for you to fund something that sounds like it's a really long way off, or might never happen at all, or, you know, at least that's their thinking. So I think trying to get them to understand that this is something that they really must do, both from a regulatory standpoint, also make sure that they understand that this is a part of their cyber resilience strategy, and if they don't include it and roll it up in what they're doing and what they're thinking about, they're leaving a lot of risk unmanaged. And so their risk management taste is what we need to actually we need to get them to focus on this as a part of that, as opposed to thinking of this as some net new thing they need to worry about. This is really risk management. So that's the education component, is to get them to think about this as just part of something they need to do.
So that's a perfect segue to challenges. That's a huge challenge, obviously, getting your partners to take it seriously, prioritize it. Is there anything else you want to add before asking the others what sort of challenges that they face?
Well, I think the biggest challenge, again, I think funding, finding the economics to do any of this stuff, getting people to focus on something that wasn't something that was even on their list at all, like just a very short time ago. That's I think what's the biggest challenge that we have. Actually, we feel pretty good about the potential for us to ensure that our service providers have their house in order in time for an early 2031 thinking. I think that's reasonable for us to think about, given we have the accreditation lever on our side and a 2-year cycle on that. But I think for the rest of the community, getting them to prioritize this is going to be very difficult.
I would like to double down on some important things that Scott has said. So the first milestone is awareness, because also Laurie mentioned funding. You're not going to get any funding unless you generate the right awareness. So that education part is very important. And here probably is where the quantum world is not helping at all. Because then people start to think about, this quantum thing, is it a hype? Is it gonna really happen? So you start entering into discussions that do not belong into the discussion that we are having. And in the end, Scott also said, this is about pure cybersecurity hygiene. And cryptography has not been well managed for history. Tim just mentioned from 1978, which is when RSA was published. But that's the reality. So basically what we are doing is putting our organizations up to maturity in cryptography management, something that we have never done before. And that has nothing to do with quantum. And a quantum computer is just setting a deadline, but the deadline has also been set by something that is not related to quantum computers, which is the NIST standard, for instance. So we do have a deadline to eliminate RSA and elliptical cryptography regardless of what happens with the quantum computers. So we need to detach the quantum discourse and start talking to risk managers, because if they think about this topic, probably they don't, but if they do, they're going to see it as a long-term risk, and it is not. It is a risk that impacts in the long term, but you're not going to be able to mitigate it unless you take action now. So it should be framed in the dashboard of emerging risks. And this has started to happen this year, but only started to happen. So we needed to make it more stronger. So I think, I spoke a lot. I leave to Laurie.
I think one thing I wanted to add is standards. And I think this is relevant for financial services, it's relevant for healthcare, certainly it's relevant for telcos. So we talk about the NIST standards and the fact that they were published. We have an initial set of standards that were published, but that's really just the beginning, because then we need to look at how those are absorbed into the various other standards, including, in the case of telco, the sector-specific standards. So if we think 3GPP has started doing some work on that, GSMA has started doing some work on that, but that cycle to be able to get, from the agreement of the standards to actually getting commercial products, that is a long cycle. And again, that needs to be factored into the plans, factored into the timelines. One of the things that we're really promoting with the clients and the partners that we're working with is to start updating the RFP requirements. So start managing the supply chain, because that really is the mechanism that will ensure that the vendors are going to be providing the things that are needed. Without that market demand, then those requirements get deprioritized. It's just the nature of how product management is done. If there's no demand, then nobody needs it. So these are some of the things that we're really sort of doubling down on, because we believe that that is the mechanism that will allow some of these capabilities to accelerate and ensure that we actually have the capabilities that are needed to support the transition to post-quantum cryptography and to crypto agility.
Great, thank you so much. Going back to what you touched on briefly about prioritization and maybe bringing that sort of standards conversation into things, how do you prioritize PQ preparedness when we know that there's so many other threat vectors out there? It feels like the sky is falling, attacks are on the rise, sophistication is ever increasing. So how do you ensure that this PQC transition gets the right prioritization, the right investment? And coming from highly regulated sectors, do you think regulators can play a role here?
Well, certainly, with regards to prioritization, a CISO today might be fired for a ransomware attack, and not for ignoring the transition to quantum safe cryptography. So that doesn't help with regards to prioritization. So, as I said before, there's a lot to do about awareness and taking the right messaging strategies in internal organization, identifying internal sponsors, and also, regulators can help a lot. So for instance, we just heard the NSA. I think CNSA 2 is a great example of what is needed, somebody putting deadlines, and CNSA 2 is not extremely precise, but it is something that everybody understands what needs to be done, and many people can adhere to that. So for instance, in the financial sector, we got PCI DSS, which is a security standards of the payment cards industry that is demanding more mature cryptography management techniques in the banking industry. The DORA regulation in Europe is also, it has 2 articles basically asking you should have mature cryptography management and inventories and crypto agility. I still hear a lot of people saying that there are no regulation demand for crypto agility, and at least in Europe, it is. However, people working with DORA are kind of ignoring the cryptography part because DORA is so complex that they are going to more easy to understand things. So people in cryptography should raise the hand and say, hey, there's a lot to do about cryptography in DORA. But still, and this is the first message in my talk tomorrow, from the deputy governor of the Banca d'Italia in the G7 workshop that we have in September, we still do not have the CNSA 2 for the financial sector. And probably that would help establish the right priorities, because deadlines will help priorities.
Yeah, I mean, I think we need to double down on awareness and clarity in terms of what is expected from organizations and what are the risks if certain things are delayed. I think the other angle I would take, which is maybe a little bit more positive, is how can things be done more efficiently, more cost effectively by starting sooner? So it's not just, if we think of the carrot and the stick, rather than just the stick, we can think about, how can we do things better? How can we do things more efficiently? How can we do them at a much lower cost if we start early? Mm-hmm. I think these are the things that are important to sort of raise awareness. Going back to the regulation aspect that you mentioned, we do have regulations in place that will be impacted from a post-quantum cryptography point of view. So if we think of in the EU, we've got GDPR. That is something that is still going to be valid, and it will be impacted by post-quantum cryptography. So these are the things, again, raising that awareness and making sure that there is clarity around expectations and that there are clarity around both guidelines and regulations, I think is a very important element of helping enterprises that are effectively facing huge amount of change in terms of what they're used to doing with cryptography and with crypto agility.
Mm-hmm.
Yeah, I think you're lucky that you've got GDPR, so we don't have any such thing in the States, right? So no general privacy regulations in the States. But healthcare certainly has HIPAA, as I said. But healthcare also has numerous agencies that are going to be looking to regulate this. So one of the biggest challenges I think that the healthcare organizations are going to have is the fleet of the boneyard of medical devices in all of the health systems. They have no idea. They treat these devices frequently kind of like like carts. They just kind of shove them around like they're just kind of a part of their their physical ecosystem. They don't think of them as computers. They don't think of them as something that has a PKI element to it, certainly. So for them, they need to start thinking about these. Some of these devices may actually just be obsolesced. So they need to start thinking about that from a budgetary standpoint immediately. So, and the FDA has started to kind of turn the crank on this, but that's where the medical device stuff is going to happen. For everything else, it'll be other agencies within HHS and OCR and their specific focus on the HIPAA security rule. I do expect that that's going to have a huge impact on things, but I also agree that there's an importance of dealing with the things that are most long-lived, like those medical devices. I think that's a thing that if organizations don't think now to do that, they're not going to have time to get it done. Not time to afford it, not time to actually do the physical work to make the replacements.
Thank you. Appreciate that answer. So before we jump to questions, which we will jump to questions in just a minute, so if you have any, you can feel free to start queuing up. I've heard we're almost at double the attendance from last year, so we've definitely got some new people joining us. And anyone who's looking at this for the first time, what recommendations would you guys share? How should they be approaching this?
Well, I would just go back to treat this as a cyber resilience topic. I think that's lump this in with everything else people are doing. If they don't understand post-quantum cryptography, fine. Just make sure that this gets on the list of things that gets included in their risk management strategies.
Yeah, skills, training, awareness, I think those are really fundamental, and this is sort of across the whole organization, because ultimately different parts of the organization will be impacted in different ways, and I think having the right level of awareness in the different parts of the organization is definitely critical. I think the other is working within the wider ecosystem and the wider community. So get involved in initiatives like this, get involved in working with your vendors, your partners, because this is going to be a team sport. This isn't something that any single organization can do in isolation.
I think they've said it all. Probably, I would suggest that organizations should find an internal champion, and so the right sponsor to create a focused team that understands the problem and leads the church on the topic, and then just double down on the last thing that Lori said. Just collaborate. This is not competitive, and we use cryptography to interoperate with others. So if the biggest threat is backwards compatibility. So if your peers do not transition, you will not transition unless you stop having them as peers. So you better help your peers follow the same roadmap that you're having.
Thank you. That's a great takeaway, and definitely something we see, at the IETF, at the NIST and CCOE migration projects. So definitely great takeaways. Thank you so much. Now I'd like to open it to questions. If anybody has any questions for our panel, please feel free. And while we're waiting, do we have any questions from remote?
Yes, we do. This is for Jaime. How do you go about performing quantum risk assessment?
We counted with an specialist, a well-renowned specialist, and we did internal interviews of different people. The conclusion, if you do a quantum risk assessment on any company today, is that you're not ready. And I've heard people saying that they've done a quantum risk assessment and they assessed that they were ready. I don't know what they assessed, but you gain an understanding by doing that. You gain an understanding of what your threat is, what your attack vectors could be, what your priorities should be.
Go to a question in the room.
Yeah, thank you so much for the discussion. This question, I think, would apply to all sectors, but specifically for the banking sector. How do you deal with organizations that may have limited resources that also need to upgrade? For example, in the banking sector, cooperatives or small union banks. How does the cooperation between big organizations help those come up as well?
So specifically talking about the financial sector, join the different initiatives of collaboration within the financial sector that exist. I'm going to mention them tomorrow. But also I have a strong belief, even though there are tools coming out there to discover your cryptography and to create your inventories. Some of them are quite expensive and not yet completely mature. And I do have the firm belief that cybersecurity mature organization has the information it needs. They only need to unearth it. I'm also gonna show tomorrow how we are starting our discovery without buying anything new, just by leveraging the tools that we already have for instance, for compliance in cybersecurity.
Thank you very much.
Maybe others?
Yeah, I think maybe just to highlight, I think there is huge value in harvesting lessons learned, and I think if we look at telco, if we look at financial services, I'm not sure to what extent it would apply in healthcare, but certainly in these two sectors, there are a lot of commonalities. For example, between a network in the US and a network in a country in Europe, there are a lot of commonalities. So there is an opportunity to harvest the lessons learned and make the most of that so that we're not sort of reinventing things that don't need to be reinvented.
Just say for healthcare, the challenge is really just the wherewithal. They actually need additional economics to make this happen, and may actually need to get help from the government in order to get this stuff done. If you're a critical access hospital with, a negative margin in a rural area, with this is not on your list of things to worry about. I think it needs to be both regulated and potentially funded as well, because they're going to need some help in this regard. I think. IBM does this risk of a breach report. It talks about the cost of a breach, and the breach report has really interesting outcomes. It says that in healthcare, when there's a breach, less like 52% of organizations will spend more on their IT budgets the next year. Only 52% of those who had a breach. And so what that tells you is that a lot of those folks just don't have the money to spend. And so they're going to need some help if they're going to do any of their cybersecurity awareness and health.
Thank you. We'll check in with Phil, see if we have another remote.
Yes, there's a question for Lori. You mentioned funding as a challenge, but how can we estimate what is the kind of funding investment needed for any telco organization?
I think that's where the inventory and the analysis comes in, and that's why it's really important to start doing that analysis to be able to put together a risk-based approach that is basically proportionate to the risk exposure. So we know that there are going to be some things that are really, really important and really business critical. We know that there are some things that just because something is vulnerable doesn't mean it needs to be fixed. And I think that is that decision, that ability to make informed decision is really, really important. And that's why that analysis is so critical, because without that analysis, you're effectively making a decision by default that is not necessarily going to be an informed decision. So I don't have any sort of magic answer around how you find the funding, but I think at the very least presenting a very compelling, well-informed, well-researched and analyzed case is the first step.
Mm-hmm. We've got another question in the room.
Thank you very much. Question for Scott. You've mentioned the issue as it relates to healthcare services and healthcare services companies. Do you have a perspective on how two other industries in healthcare are handling the issue, which is health insurers and then also pharma companies as it relates to clinical trials data, data acquisition and transfer? Thank you.
Yeah, so it's interesting. I think that both those sectors are kind of new to interoperability of the sort that they're starting to see happen in the ecosystem. And so the good news for the payers is that they have new obligations to make connections to providers that they never really had before, where before all of that communication was done through clearinghouses. Really, pretty much all the technical connections they made was that way. I think that the payers are in a good position to actually deal with this through they frequently use service providers like everyone else. They'll use very robust external organizations or even internal subsidiaries in the payer space. That's pretty common. And I think they're actually well equipped to do this work for the payer. I think pharmaceutical companies, because of their FDA obligations, they do pretty good work there. But I think that the FDA doesn't hold them to a very high standard of communication around the data that goes between pharmaceutical companies and the FDA, for example. It's fairly lightweight, to be blunt. But anyway, I think that they will understand it because they will be regulated strenuously.
Jaime, Lori, Scott, thank you so much. I believe it's lunchtime, so
it's definitely
yeah,
lunchtime.
Appreciate
People
your
are
insight.
getting hungry, so I really need to get you off stage now and free everyone to go for lunch. We have lunch served on the third floor and in the breakout room, or in the break room, so in the under the oaks downstairs. Yeah, we would like to see you back at 2 o'clock. And then we have Blair Canavan from Thales talking about 2025 is here. How to get your PQC readiness plan underway. In this room and in the breakout room, we will continue with Ini Kong on online quantum readiness tools. And those sessions will also be moderated by a new host, but we will come back to that after lunch. Thank you.